Everybody talk about FODMAP diets, low FODMAP. This came up from the Monash University in Australia. We use it in some patients. These are fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, poorly absorbed. They get metabolized in the colon and they produce gas. And if you have hypersensitivity and you produce gas, similar to what happened with lactose intolerance, if I eat lactose, even if I have a little bit of lactose intolerance, maybe nothing happens. I feel uncomfortable. But if I had hypersensitivity, I would have a lot of symptoms. And you can imagine that this distension, as you can see in the MRI, in patients who eat fructans, that distension, if you have hypersensitivity, would cause symptoms. We know in children that fructans is one of the culprits, and that and we were wondering, and we know the low FODMAP diet works in some cases, although we don't have too much evidence. There are not enough studies in pediatrics, almost no studies showing that low FODMAP diet really worked. We had that question. We said, maybe children have so much pain in school because they eat too much FODMAP. Maybe children are just like, if you go to a community and if you have a lot of FODMAPs, you may get pain. Or maybe children with functional abdominal pain disorders at the community level, they have more pain than their peers. So we did a study that, unfortunately, I cannot give you a reference because it was rejected by, I don't know, every possible journal that exists. I don't know why. This was a beautiful study, interventional study done in Argentina, in which we modified the diet for 5 days into days of high FODMAP, low FODMAP, and normal FODMAP. We gave them questionnaires. And what we found is that children on days of high FODMAP, yes, children have a little more symptoms, like all of them, with and without functional abdominal pain disorders. And there was no relation, no clear relation between the history that children provided and really FODMAP triggering the symptoms. So maybe there is a selection bias there.